Welcome to the deep dive. Today, we're getting into something I think a lot of us wonder about our cats' inner lives.
Mm-mm.
Specifically, we're exploring fear and anxiety in cats.
It's a really important topic.
We've been looking through some material mainly based on feline fear and anxiety.
Right.
And our mission, really, for this deep dive is to pull out the key stuff, help you understand why your cat might react in certain ways.
Yeah, to get a clearer picture of these, emotional states.
Yeah.
Because sometimes their behavior can seem, well, baffling.
Totally. So this should help shed some light.
Hopefully, give you a better sense of what's going on under the surface.
Okay, let's start with the basics then. Fear, anxiety, phobias in cats. What are we defining here?
Well, fear is, fundamental. It's about survival.
Like a loud bang.
Exactly. A sudden noise, a direct threat from outside, that triggers an immediate alarm.
The classic freeze, fight, or flight.
That's it. That's fear in action.
Okay, so how is anxiety different then?
Anxiety is more about anticipation.
Anticipation?
Yeah, like feeling apprehensive about some potential danger. Maybe it's unknown, maybe it's imagined. And what's really key is that the body's reaction, the physiological stuff, it's very similar to fear, even without a clear threat right there.
So it can linger after something scary happened.
It can,
Yeah.
yeah. Or it can pop up just because their environment or routine changes unpredictably. Cats often like predictability.
Right, and phobias, where do they fit in?
A phobia is like fear kicked up several notches. It's really intense, persistent, and focused on a specific thing.
Like thunderstorms. I've heard of cats being terrified of those.
Thunderstorms, yeah. Or maybe extreme distress when they're separated from their person. The source material points this out.
So it's excessive, really, out of proportion.
Exactly. The intensity and how long it lasts are the hallmarks, often way beyond the actual danger.
Got it. Okay, so we have these definitions. Now, when a cat feels fear or anxiety, it's not just in their head, is it? What's actually happening physically?
Yeah. Oh, absolutely, not just mental. When a cat's stressed, especially if they feel, trapped or like they can't get away,
Yeah.
it sets off this whole cascade of physical reactions in their body.
Which are helpful initially, I guess, for survival.
They are, initially. But they become a problem when the stress just keeps going, when it's chronic.
Okay, so what kind of physical changes are we talking about?
Well, behaviorally, you might see them get really hypervigilant.
Like constantly scanning,
Hmm.
on edge.
Yeah, exactly. Always on alert. They'll usually try to avoid whatever's making them scared or anxious.
And if they can't avoid it?
Well, if they feel cornered or are handled when scared, that avoidance can unfortunately flip into aggression.
Right. What about inside their bodies? Like their heart?
Yep. Heart rate speeds up, blood flow gets redirected, prioritizing the vital organs,
Getting ready for action.
preparing them for that fight or flight, basically.
Makes sense. And hormones, is that part of it too?
Big time. The endocrine system, the metabolic system, they jump in, they release glucose quick energy.
Ah, like a sugar rush?
Sort of, yeah. And stress hormones, glucocorticoids,
Mm.
think of them as the body's alarm system and emergency fuel.
Wow. And what about, like, digestion?
Interestingly, that often slows down,
Yeah.
which is why you might see their appetite decrease when they're stressed out.
Huh. I hadn't thought of that link.
And long-term chronic stress,
Hmm.
it can actually weaken their immune system.
Making them more likely to get sick?
Potentially, yes. It compromises their defenses over time.
It's really striking how deep these effects go. Are there other, maybe more visible signs?
Sure. Musculoskeletal-wise, you might see weight loss eventually if they're not eating well or hiding a lot and being less active.
So less movement overall.
Less activity, yeah. You might also notice physical tension, maybe trembling, or even repetitive behaviors,
Like what?
like pacing or sometimes excessive licking in one spot, trying to self-soothe maybe.
And their eyes. People always talk about cat's eyes.
Good point. Pupils will often dilate, get really wide,
Yeah.
and their breathing might get faster, shallower.
Panting even.
Sometimes, yes, even if they haven't exerted themselves. And overgrooming can be a secondary thing too, licking themselves bald in places sometimes.
Wow. Okay, so their whole system is basically on red alert.
Pretty much, yeah.
Let's try and unpack the why then.
Mhm.
What causes this? What makes some cats more prone to being fearful or anxious than others? Any risk factors?
It's complex, and we don't have all the answers, especially on genetics.
But there might be a link.
The source suggests there could be. Some studies hint at links, maybe between breed or coat color and certain tendencies. Even the father cat's personality might play a role.
Interesting. So nature might be part of it. What about nurture? Their life experiences?
Oh, hugely important, especially early life. Think about kittens.
That socialization period.
Exactly. That critical window, roughly 2 to 7 weeks old, it's when their brain is wiring up how they perceive the world.
So if they don't have good experiences then,
A lack of positive interactions, not enough gentle handling, poor socialization, it can significantly increase their chances of being fearful adults.
makes sense. And bad experiences obviously count too.
Of course, any negative or traumatic event can leave a mark. And they can even learn fear
Learn it. How?
by watching other cats. If their mother was very fearful or they live with another anxious cat, they can pick up on those cues and reactions. Observational learning.
Fascinating. And what about just social stress? Like too many cats?
Yeah, that too. Especially in multi-cat households or outdoor colonies, the social dynamics and competition for resources can be a constant source of stress for some cats. Population pressure, basically.
That early window, 2 to 7 weeks, sounds absolutely critical.
It really, really is.
So thinking as cat owners, how do we spot this? How do we recognize fear or anxiety in our own cats? What are the signs?
Well, first off, remember every cat's different. The signs can really vary depending on the cat and the trigger.
Okay.
In milder cases, it might be subtle, just like a general tenseness.
Holding themselves stiffly?
Yeah, or maybe they startle more easily than usual. They might retreat more, hide away, or just seem less active overall. Reduced movement.
Okay, those are the quieter signs. What if it's more intense, like real panic?
Oh, when they're truly panicked, the reactions can be much bigger, much more dramatic.
How so?
They might become defensively aggressive if they feel trapped, lashing out, or even destructive, clawing frantically at doors or windows trying to escape.
Wow. And the triggers can be specific things.
They can be very specific, yeah. A certain person, the vacuum cleaner noise, the cat carrier, or sometimes the anxiety is more generalized,
Meaning?
meaning they just seem sort of on edge in lots of different situations without one obvious trigger.
And body language.
Yeah.
That must tell us a lot, right? What should we look for?
Definitely. Their ears are a big one. Flattened back against the head or swiveled sideways.
Okay.
Their whole posture might get low and crouched, even when they're still.
Okay.
Head lowered. Tail tucked really tight or held very low.
And the fur standing on end?
Piloerection, yeah. That classic Halloween cat look along the back and tail makes them look bigger, more intimidating.
Eyes.
Pupils usually dilated, very wide. You might see panting, like we said, even without exercise. Shaking, maybe drooling. Even shedding can increase suddenly under stress.
Shedding. Really?
Yep, stress shedding's a real thing.
Good to know. Are there any other signs, maybe less common ones, of really extreme fear?
In really intense moments, yeah. Some cats might lose control of their bladder or bowels.
Oh, wow.
Or they might express their anal glands. It's an involuntary stress response.
And vocalizing. Do they get loud?
Interestingly, often not. They tend to go quiet when fearful, unless they feel they absolutely have to defend themselves with hissing or growling.
But sometimes they do vocalize more.
Some anxious cats do, yes.
Mm.
They might pace around, meow constantly, and actually seek out their owner.
Which could be confusing, right, if you don't realize it's distress.
Exactly. It can seem like attention-seeking, but it's often anxiety-driven, and then you might see secondary behaviors develop over time.
Like spraying.
Like urine spraying outside the litter box.
Yeah.
Or destructive scratching on furniture. These can be ways they try to cope with underlying anxiety.
And knowing their background, their history, that can help interpret things.
Oh, for sure. If you know a cat had poor socialization or wasn't exposed to much as a kitten, or maybe came from a feral background,
Yeah.
that history makes fear and anxiety perhaps more likely, or at least gives context to their behavior.
And it's worth remembering they might act totally different at the vet's office compared to home.
Absolutely critical point. The clinic environment is often stressful, so their behavior there might not reflect their usual self at all.
Right. Okay, so we've talked a lot about recognizing the problem. Let's pivot towards solutions. Managing and treating this, what are the key ideas?
Okay, first things first. Really try to figure out the specific triggers. What sets them off?
And then avoid them.
If possible, yes. Avoiding or minimizing exposure is the ideal starting point. And alongside that, providing safe places is crucial.
Safe places, you mean like hideaways?
Exactly. Spots where the cat feels totally secure, undisturbed, and can just retreat when they feel overwhelmed or scared.
What makes a good safe place? High up.
Often, yeah. Cats frequently feel safer up high. So a clear shelf, a tall cat tree they like, even under a bed or inside a closet sometimes.
The key is they choose it.
Yes, and they have easy access. And crucially, they know they won't be bothered there by people or other pets. It's their sanctuary.
Okay. And what if you have to handle a scared cat, like for a vet trip?
Great question. Calmness is key. Moving slowly, speaking softly, and using physical aids cautiously can help.
Feeds like.
Maybe a soft carrier that opens from the top is less stressful than shoving them in the front. Gently wrapping them in a thick towel, a kitty burrito, can help restrain them safely and make them feel a bit more secure. Cat muzzles are sometimes necessary for safety, but need careful introduction. The goal is minimizing stress and preventing injury to them and to you.
Right. What about actually trying to change their response? The source mentioned desensitization, counterconditioning.
Yes, those are key behavioral modification techniques. Desensitization means exposing the cat to the scary thing, but at a really, really low level.
It's so low it doesn't scare them.
Exactly. So low, they barely notice it, or at least don't react fearfully. Then very, very gradually, over time, you might increase the intensity, always staying below their fear threshold.
Okay, slow and steady. And counterconditioning.
That's about changing the cat's feeling about the trigger. You pair the presence of the trigger, yet at a low level, with something absolutely wonderful for the cat.
Like amazing treats. Or playtime.
Precisely. High-value food, their favorite game, whatever they love. The goal is to overwrite the fear response with a positive emotional association. Oh, that slightly scary sound means chicken is coming.
Ah, changing the association.
Exactly. And don't forget, you might also need to separately address those secondary problems we mentioned.
Like the spraying or aggression.
Right. Those might need their own targeted plan, even as the underlying anxiety improves.
Okay. Now, medication. That's often a big question. When does that come into play? And what do we need to know?
Medication can be a really helpful adjunct, a supporting tool, alongside the behavior changes.
Especially for severe cases.
Yes, particularly when the fear or anxiety is so intense, it's really impacting their quality of life. Or it's blocking them from being able to learn from the desensitization and counterconditioning. They're just too stressed to learn.
But there's a catch, right? About approvals.
There is, and it's really important for owners to understand this. Currently, no medications are specifically FDA approved for feline fear or anxiety.
So vets are using them off-label.
Essentially, yes.
Yeah.
They're often using medications approved for humans or other conditions and basing the decision on clinical experience and data extrapolated from human studies or studies in other animals.
So it requires a really good conversation with your vet.
Absolutely. An open, honest discussion about the potential benefits, the risks, the side effects, and the fact that it's an off-label use. Consulting a veterinary behaviorist is possible, is often ideal here.
So medication isn't a magic bullet.
Definitely not. Think of it more like lowering the volume on the anxiety so the cat can actually hear the behavioral training and start to cope better. It creates a window for learning.
Gotcha. What kinds of meds are typically used?
Well, the source mentions a few main classes: SSRIs, selective serotonin reuptake inhibitors,
Like Prozac.
Fluoxetine, which is
Huh.
Prozac, yes, or paroxetine. They help regulate mood. Potential side effects could be things like decreased appetite, sometimes temporary irritability, maybe constipation,
Okay. What else?
TCAs, or tricyclic antidepressants, like clomipramine or amitriptyline, another option, but they can sometimes cause sedation or have what are called anticholinergic effects, dry mouth, that sort of thing. And there could be heart considerations with some TCAs.
Anything else?
There's a class called azapirones, like buspirone, sometimes used for milder, more generalized anxiety. Side effects might include some GI upset, mild sedation, or paradoxically, sometimes it can lower inhibitions around aggression in some cats.
Oh, interesting.
And then there are benzodiazepines like alprazolam, Xanax.
For short-term use.
Typically, yes, for predictable stressful events, like maybe travel or vet visits, but they can cause sedation, increased appetite, and also carry that risk of disinhibiting aggression in some individuals. They can also potentially interfere with learning long-term behavioral changes.
Wow. So lots of options, but all with potential side effects to weigh up.
Exactly. And there are definite contraindications too.
Like when you absolutely shouldn't use them.
Yes. For instance, if a cat has a history of seizures, certain drugs like SSRIs and TCAs might not be the best choice. And combining certain psychiatric medications can be dangerous, so the vet needs a full picture of everything the cat is taking.
Makes sense. So if a vet does recommend medication, what happens first? Just prescribe it.
No, ideally not. It's really strongly recommended to run some basic lab tests first.
Blood work.
Yeah, blood work to check liver and kidney function, mainly. Make sure there are no underlying health problems that could be causing the signs or that would make using the medication risky. Rule things out.
Good practice. And getting pills into cats. Notoriously tricky.
Oh, tell me about it. It can be a real challenge. That's where compounding pharmacies can be amazing.
Making it into a liquid or chew.
Exactly. Flavored liquids, tasty chews, sometimes even transdermal gels you rub on their ear. It can make a huge difference for actually getting the medication in consistently, which reduces stress for everyone.
Definitely. And checking for interactions with other drugs is vital.
Absolutely. Always double check with the vet or a veterinary pharmacist about any potential interactions.
Okay. What about non-prescription options? Pheromones, herbal stuff.
Yeah, those can definitely play a role in a multimodal plan. Pheromone therapy, like Feliway products.
I've seen those. The diffusers and sprays.
Right. They mimic natural calming feline pheromones. For some cats, they can help create a sense of security, maybe during travel, vet visits, or changes at home.
Worth a try, maybe.
Can be, yes. And some supplements have a bit of science behind them, too. L-theanine, for example, found in green tea, has shown some promise for promoting relaxation.
Okay, but caution is needed.
Yes, especially if the cat is also on prescription meds. Herbal remedies aren't always benign, and they can interact with psychotropic drugs. Always keep your vet in the loop about everything you're giving your cat, supplements included.
Good advice. So, looking long-term, managing feline fear and anxiety sounds like it's often an ongoing commitment.
It often is, yes. Success usually involves regular check-ins with your vet, especially early on.
To see how things are going, adjust meds.
Exactly. Monitor effectiveness, tweak dosages if needed, troubleshoot any issues, and frankly, to support you, the owner, and keep motivation up because it can be a long road sometimes.
And prevention is key, going back to those early weeks.
Absolutely. Calm interactions, positive socialization between 2 and 7 weeks that lays the best foundation. Continuing positive exposure throughout the first year helps too.
And even if the anxiety gets better, those secondary issues might stick around.
They might, yeah. Things like spraying or maybe tension with another cat might have become habits and could require their own specific behavior plan even after the root anxiety is better managed.
So, what's a realistic outlook? Can cats fully recover?
It really varies. The prognosis depends on so many things. The cat's history, their temperament, the home environment, how often they face their triggers.
So some cats might not change much.
Some cats, especially those who are profoundly shy or were very poorly socialized, might only show minimal improvement. The endpoint looks different for every cat. Medication can often significantly improve their quality of life and make them more comfortable, but it might not erase all the signs completely.
It's about managing it, making life better for them.
That's the goal, yes. Helping them feel more secure and cope better day to day.
This has been incredibly insightful. So to sort of wrap up, understanding fear and anxiety in cats means looking at both their physical reactions and their behaviors.
Right, they're deeply connected.
And early life, maybe genetics, they play a part. Management involves fixing the environment, using behavior techniques.
Creating safe spaces, desensitization, counter-conditioning.
And sometimes carefully considered medication with vet guidance.
Exactly. It's often a multi-pronged approach.
And by understanding all this, hopefully we can all be better at spotting when our cats are struggling and giving them the right support.
That's the hope. Helping them thrive, not just survive.
So here's a final thought to leave you with. Considering how complex fear and anxiety are in cats, how these emotions shape their whole being, what can learning about their experiences teach us? Maybe about our own stress responses, or just how vital creating safe, secure environments is for everyone, human or animal.
It definitely gives you perspective.
Maybe watch your own cat with some fresh eyes after this. See if you notice things differently. Thanks for joining us for this deep dive.